our great health commissioner to give an update on coronavirus.
Thank you, Governor. Good afternoon. As we have said over the past few weeks, the risk to the public in New York State is currently very low. And together we are all closely monitoring the developments in China as well as here in the United States. The bottom line is we are very well prepared for this response, and New York State and local public health officials and all the healthcare facilities are very experienced with infectious control practices. New Yorkers should remain vigilant in protecting themselves and their families, and we really should just stick together, not attack one another. We're going to get through this like we've gotten through so many other things. Thank you very much.
I understand the fear. We've gone through this before, Zika virus, Ebola, etc. But let's have some connection to the reality of the situation. And as the doctor said, catching the flu right now is a much greater risk than anything that has anything to do with coronavirus. Yes, it is a serious illness, has a higher mortality rate than the flu, etc., but not like Ebola, not like some of these other situations. We had 17,000 people in the state of New York last week who had the flu, 17,000. Not like Ebola, not like some of these other situations. Not like Ebola, not like some of these other situations.
We know that there's currently no indication that it's easy to transmit by casual contact. There's no need to do any special anything in the community. We want New Yorkers to go about their daily lives, ride the subway, take the bus, go see your neighbors, ride the subway, take the bus, go see your neighbors.
You cannot contract it through casual contact, so the subway is not the issue. The train is not the issue. The issue is prolonged, consistent contact. Subway's not our problem right now. Home is our problem. If you get a hit for pneumonia, for all intents and purposes, it means you don't have coronavirus. Maybe there's some perverse exceptional case, but for all intents and purposes, if it's pneumonia, you don't have coronavirus. True?
That is true.
The message to New Yorkers from the beginning has been, this is something we all can handle together. Go about your lives, go about your business. People are doing that consistently. New Yorkers do not scare easily, do not intimidate easily.
One of the consequences to this, an economic consequence, is people are worried about traveling. That is constricting travel, constricting business travel. It's not good for New York. It's not good for any state because it can actually slow the economy.
If you are sick, don't go to work. Call your doctor if you're not better in 2 to 3 days.
We are introducing New York State Clean hand sanitizer made conveniently by the state of New York. This is 75% alcohol. It also comes in a variety of sizes. It has a very nice floral bouquet. Facts here do not justify the amount of fear. I understand it's a virus. I understand it sounds like a bad science fiction movie. This is not the Ebola virus. We've dealt with that. That was a much more dangerous, frightening virus. How many people died in the United States from the flu last year? Roughly 80,000 from the flu. All the experts say social distancing. You should be more than 6 feet from someone. Try walking down a New York City sidewalk and be 6 feet from people. It would be virtually impossible. So reducing density, how do you do that? Ask the businesses to cooperate. The way to reduce the spread, the rate of the spread, two-prong approach, reduce the density. Yesterday we announced measures to reduce the density, gatherings of 500 and over, etc. Centralization of a function is very effective if the goal is quality control over flexibility and speed and volume. Many tasks we do on a centralized basis. Now you change the fact pattern. By the way, we need tens of thousands of tests all across the country, and we need them tomorrow. Centralization doesn't work. You must go to a decentralized model of management. The centralized mechanism cannot do that for you. You can't come up to scale with a centralized management system. So I think it was the right call.
Why are you critical of the president for leaving it to the states to do their own testing and having to take that ball and carry the ball?
No, I think I asked for New York's ability to do the testing. I'm praising that decision. I'm not criticizing that at all. First, as I've said before, this is a national problem and we need federal leadership. This is a national problem. It cannot be done in a piecemeal method. You need federal parameters to stop the national patchwork. You see a whole hodgepodge of efforts being taken across the country. This state is doing this state is doing this city is doing this. It's chaos.